2 people have now died after getting a Johnson & Johnson COVID-19 vaccine. According to the South African Health Products Regulatory Authority, both fatalities were linked to the Guillain-Barre syndrome. It's a rare condition. For more, I'm joined now by Shabir Madhi, Professor Shabir Madhi. He's the Dean of the Faculty of Health and Sciences of Vaccinology at Wits University. Prof, thank you so much for your time here on All Angles. We, of course, spent about 2 days trying to get a hold of you for this particular story for the obvious reason that South Africans are now probably going to panic after hearing about 2 deaths as a result of Johnson & Johnson vaccine, COVID-19 vaccine, that is. Is there a need for South Africans to panic after these news?
Good morning, and thank you for having me. So the concern around the safety of the vaccine clearly is an important issue, not just for the public, but also for the medical fraternity. But at the same time, we need to understand that all vaccines do come with some element of risk. So in South Africa, as an example, there's been more than 9 million doses of Johnson & Johnson vaccine that have been administered, of which, unfortunately, 2 individuals have died as a consequence of vaccination. But the number of lives that have been saved far exceeds the number of people that unfortunately have succumbed because of a serious side effect. And my condolences to their families. But at the same time, this risk that is observed for the Johnson & Johnson vaccine in relation to Guillain-Barre is not the case for the messenger RNA vaccines, the Pfizer vaccine. So the Johnson & Johnson vaccine, unfortunately, is about 20 to 25 times more likely to cause this extremely rare side effect compared to the Pfizer vaccine. So if people are uncomfortable about getting a dose of the Johnson & Johnson vaccine, then my suggestion would be that they opt for the Pfizer vaccine.
So this Guillain-Barre syndrome, it's not necessarily something that a human being already has, is it? It's caused by the vaccine?
Well, not just by vaccines. So Guillain-Barre syndrome is something that exists even outside of a side effect of a vaccine. There's different causes of Guillain-Barre, and many of the cases of Guillain-Barre is thought to be caused by viral infections. And this is something that occurs throughout the year. So it's not that it's only vaccines that causes the syndrome. But some vaccines, including influenza vaccine as an example, and not just COVID vaccines, there is some association of those vaccines causing Guillain-Barre, but extremely uncommon. So there's roughly 1 out of every 200,000 people that are vaccinated might develop this complication. And in fact, the majority of individuals that do develop this complication from vaccination would recover. So when we say there's 2 people that have been identified to have died of Guillain-Barre syndrome in South Africa, those are not the only 2 cases of Guillain-Barre syndrome that's occurred. There's probably 5 times more cases that has occurred in South Africa, but about 20% of those individuals will go on to die. But again, the number of cases are fairly nominal compared to the large number of cases of hospitalization that's been prevented, as well as a large number of lives that have been saved by vaccinating.
So what should we look out for then as South Africans, especially those who are listening right now and thinking, oh my goodness, that's exactly the vaccine that I opted for?
Yeah, so most of the side effects usually occur within a certain period of time, and usually that's around about 4 to 6 weeks after being vaccinated. So if you've been vaccinated more than 6 weeks ago, and if you develop this sort of a syndrome, it's extremely unlikely to be due to the vaccine. It's probably related to some other cause. So people that have been vaccinated more than 4 to 6 weeks ago, there certainly shouldn't be any concern that they would develop this sort of complication because they've passed that window period for developing this sort of complication from vaccination. And people that have been vaccinated in the previous 4 to 6 weeks with the Johnson & Johnson vaccine, they start experiencing sort of tingling sensation in the feet, and they start developing weakness, which starts off usually in the lower limbs. Then they certainly should come forward for medical attention. But the chances of that happening again, to emphasize, is extremely, extremely uncommon. Roughly 1 out of every 200,000 people that are vaccinated might develop this complication.
And I mean, you can imagine the type of nightmare this is going to cause, Prof. Madhi. I mean, I don't know how you would advise government, for instance, to speak to South Africans or to assure South Africans at this point, because if there's a need for us to go for our 4th dose, etc., a lot of people might not want to, especially because we're in a continent where vaccine hesitancy was quite rife.
Absolutely, and even in South Africa, it's only about 1/3 of the population that have received at least a single dose of vaccine. So people still need to come forward for vaccination, and particularly people that are at high risk of developing severe disease, who might require 3 to 4 doses of vaccine. But again, also to emphasize that if people do have concerns about the rare side effect from the Johnson & Johnson vaccine, we are fortunate in South Africa in that we do have other options, which is a Pfizer vaccine, which is not associated with a heightened risk of developing Guillain-Barre syndrome. So there are other options available in South Africa for those individuals that want to be cautious in terms of mitigating the risk of developing the syndrome.
Do we know, I mean, my question is twofold, because I know that this was uncharted territory for all of us, including the medical and scientific profession, when it came to COVID-19 ascending on the world, etc. But do we know why Johnson & Johnson is more susceptible to this particular syndrome? And, Prof, why didn't we know before that this might be one of the side effects and warn people who decide to take that particular vaccine?
Yeah, and that's a really important question. And like I said, it's not just Johnson & Johnson. The AstraZeneca vaccine probably poses a similar risk. And even the seasonal influenza vaccines do pose a risk of developing this sort of syndrome. But it hasn't been in the public domain or very much in the public domain in the past because of the rarity of this occurrence. But there's much more of a spotlight when it comes to COVID-19 vaccines, including when you develop these rare side effects. The reason why we didn't identify this in our clinical trials is, like I mentioned earlier, the frequency of developing this event is about 1 in every 200,000 individuals. When we do our clinical trials, at most, we usually enroll maybe 15 to up to 40,000 individuals in a clinical trial. So the chances of detecting this sort of an event in a clinical trial is extremely, extremely unlikely because of how rare this condition is, and when you're only enrolling 40,000 individuals, you don't expect any of them to develop this complication. If your chances of developing the complication is 1 in 200,000. So that's the reason we do what we refer to as post-marketing or post-implementation surveillance. And that's how this was identified in South Africa, as well as many other countries. When you start having millions of individuals that are vaccinated, then that starts unmasking these really rare side effects of vaccination, which unfortunately you're unable to identify during the course of doing clinical trials.
Quite unfortunate to those two families, and of course we do send our sympathy and condolences to them. Thank you very much for speaking to us here on eNCA, Prof. Always a pleasure. Professor Shabir Madhi, the Vaccinology Dean in that particular department at the University of the Witwatersrand.